Alright. Oh no, not that way either. Hang on. There we go. Okay. Okay. My name is Samantha Wilson, and this is my complex health assessment for D222. Alright. My name is Samantha, and I will be your nurse today. Can you tell me your name and date of birth, please?
Stephanie. It's April 28th, 1981.
Okay. And can you tell me how old you are?
42.
Alright. And do you know why you're here right now?
For a health assessment.
Okay. And do you know what today's date is?
Today is Sunday, July 30th.
Yes. Okay, so the patient is alert and oriented to person, time, and place. And how has your appetite been lately?
I've been very hungry.
You feel like you're eating well then?
Yes.
Okay, and the patient is eating well. She is upright and she has no obvious physical deformities. There's no limited mobility noted. She has appropriate facial expression for the situation. Her mood and affect is appropriate, as well as her speech is clear and appropriate. No hearing difficulty noted. Her personal hygiene is clean and kept, and she appears well groomed. So the first thing we're going to do is start with your vital signs, and can you tell me your height and weight?
I'm 5'2" and 138 pounds.
Okay, perfect. So we'll be using this blood pressure cuff for the assessment portion. And I'll be using my stethoscope and listening to her brachial pulse while I do her blood pressure cuff. I'll pump it up and listening for her brachial pulse. And it is 120/70, so that is normal. Or radial pulse, not radial pulse, yeah. No, I gotta check your radial pulse. Alright, and then I'm gonna check her temperature. This takes longer than 3 seconds. Alright. And her temperature is 98, and that is normal. And then I'm going to check her radial pulse for 30 seconds. And I'm going to multiply that by 2, and that is 68, and that is normal. And non-thready, it's even. While I'm doing her pulse, I'm also going to be looking at her respirations and counting those, and those appear even and non-labored, and those are, while I was doing her pulse, I noted those to be 18, even and normal as well. Right, and are you having any pain at this time?
No.
No, okay, perfect. All right, next we're going to be moving on to her skin assessment. Let me see your arms, please. Her skin is pink, warm, and dry. I don't know any lesions or abrasions on them. She appears to have good skin color, no tenting, good skin turgor, no problems in her skin texture at all. And then I'm just going to look at your scalp and check her head, feeling her hair is evenly distributed. I don't know any lesions or anything like that on her scalp. It appears to be intact. I don't know any trauma or lumps. I'm going to check your cranial nerve 7 next. If you can smile for me, and then can you raise your eyebrows up? Okay, that appears to be intact and symmetrical. If you can puff your cheeks out and blow. Okay, perfect. All right, that appears to be intact. Next, we're gonna move on to your eyes. And I have my light over here. And then if I can just have you pull your eyelids down for me. I'm just looking at her conjunctiva and her sclera. That looks normal. And then I'm gonna have you cover one eye. I'm just gonna check your pupil reflex. Perfect. Now if you do the same thing with the other hand, we're just gonna check your pupillary reflex. Perfect. And then while covering that eye again, I just would like you to tell me when you can see my finger.
Right now.
Okay, perfect. Now do the other eye and tell me when you can see my finger. Perfect. And then I want you to follow this little doodad here with your eyes only. Don't move your head. Good. Perfect. Perfect. Good deal. So that is checking her reflexes. Her pupils are equal reactive to light, so they are pearl. Her visual fields and cranial nerve 2 are all equal. No deviations there. Are you having any double vision or blurred vision at all?
No.
Okay, perfect. Next, I also assessed her cranial nerves 3, 4, and 5, and those were all equal as well. We're gonna move on to her ears. So I'm just gonna look at your ears here and feel around there. Any pain or tenderness when I touch your ears? Her ears are symmetrical. I don't know any drainage with them. No vertigo or hearing loss at all.
No.
So that appears to be normal as well. No findings there. And then her nose, moving on to that part of the assessment. Her nose does appear to be midline. There's no drainage noted there. If you could plug one side of your nose and blow out. Okay, and then the other side. Perfect. They do appear to be patent bilaterally, so no difficulties there. Moving on to her mouth and nose. Her lip color appears to be pink, dry, and intact. There's no lesions or bruises anywhere on her lips. They're both symmetrical in shape. If you could move the sides of your cheeks for me, open your mouth and say ah. Okay, perfect. Buccal mucosa is pink, intact, and moist, no lesions noted. She doesn't appear to have missing teeth or cavities. She's got nice looking teeth. Her gums are pink, moist, and intact. She doesn't have any lesions. Her tongue is also intact, nice pink color, no lesions. Her uvula is also midline and mobile. When is the last time that you went to the dentist?
About 6 months ago.
Okay, and you brush your teeth how often?
At least once a day.
Okay, perfect. And you floss?
When I remember.
Okay, perfect. And you have dental appointments every 6 months?
Yes.
Okay, good. Alright, so no abnormal findings with her mouth or throat. Just gonna check for cranial nerves 9 and 10. Grab my little tongue depressor. Well, if I had a tongue depressor, I would check your gag reflex and have you say ah. So I don't have that right at this moment, but if I did, I would check for that. Okay, moving on to the neck, I'll palpate your carotid pulses, just one at a time. Feel here and here. Okay, those are good. Those are equal bilaterally, palpable, and they are +3. And then I'll also feel your trachea. Right, that is midline, no deviation. And then checking for range of motion, can you put your chin to your chest and then move it back up, and then side to side. Any pain or difficulties with that?
No.
Okay, perfect. Alright. Then moving on from your neck, we'll go to the posterior chest part of the assessment. So just moving to that part of the assessment, we'll go to the posterior chest, and then we'll go to the back side of the chest. So we'll just move the camera. Hopefully it doesn't fall. Okay. So then just looking at the back side of the chest, it is symmetrical. So I'm just gonna palpate any pain or tenderness here.
No.
Okay, and then I'm just gonna place my hand on your back, and if you could say 99.
99.
And then say it again.
99.
And again.
99.
And again.
99.
Alright, and that was checking for that metis, and that is equal in all areas. And then checking for that expansion, I'm just gonna feel down here. If you could take a deep breath. Okay, that's good. And that is symmetrical with expansion. And then was there any tenderness when I palpated at all?
No.
No, okay. And then I also did not note any crepitus when I was palpating either. And then her posterior chest was also flat when I was palpating. I'm just gonna listen to your chest in 6 places. So if you could take a nice deep breath whenever you feel my stethoscope. Okay. Her lung sounds are clear bilaterally, no adventitious lung sounds, no rhonchi, crackles, or wheezes. And then I'm also gonna check the costovertebral angles of your ribs. So I'm just gonna feel down here, and then tell me if you feel any tenderness.
Nothing.
Okay, perfect. So our posterior chest appears to be intact, no pain or anything like that. And then we're going to move on to the anterior chest. So we'll move back over this way. Move my little hand now. So then the same thing, we'll check for the fremitus, if you could just say 99.
99. 99.
Okay, any pain or tenderness with that? Okay, perfect. So then I will just listen. I didn't feel any crepitus with that at all either, and no fremitus noticed either. So I'll just listen to your lungs. So nice deep breath. Okay, perfect. Nice clear breath sounds. No adventitious breath sounds noted there either. They were clear bilaterally throughout. Alright, and then moving on to your heart. I did forget to ask you, are you experiencing any shortness of breath?
No.
Okay, perfect. Now we're moving on to your heart. So I'll just listen to your 5 heart sounds, and then we'll check for your apical heart rate. Perfect. Apical pulse is nice and strong. Any chest pain at all with that?
No.
No, okay. And I did not hear any murmur, and I would also take the apical heart rate for 60 seconds. Alright. So that was good. Alright, and then upper extremities, we'll move on to that portion. So we'll just check your range of motion. If you could put your hands out in front of you and then move them, move them to the sides and then up above your head and then back down. Was there any pain with that at all?
No.
Okay, I'll have you grip my hands. Okay, equal grip strength, that's good. And then I'll have you push your hands up and then don't let me push. And don't let me pull them down. Perfect. And then I'll have you put your hands like this and then try to push them out. Perfect. And then don't let me push them in. Okay, perfect. So those are equal grip strength in both fingers. I'll also check your capillary refill. See your hands. Good capillary refill, that's less than 3 seconds. And then I will just check your brachial and radial pulses. So there's brachial pulse. Brachial pulse is +2. And then both radial pulses there are, both radial pulses are +3. So upper extremities are good. And then I'll just have you swing around and we'll check for some jugular vein distension. And I'm not noting any jugular vein distension on either side, so that is good. So that is negative bilaterally. And then moving on to the abdominal portion. Just observing the abdomen area that appears symmetrical and flat. Can I lay you a little flatter? Yes. Okay. Whoa. The pillow for you. Her abdomen appears symmetrical and flat. Her umbilicus does appear to be center and midline. There's no indentations or obvious deformities. So I'm just going to listen to your bowel sounds before we do palpation. Perfect. Bowel sounds are active in all quadrants. And I'm just going to percuss in all the quadrants here. Any pain or tenderness when I do that?
No.
Okay, perfect. Any pain or tenderness with palpation?
No.
Okay, then we'll go a little deeper. Any pain or tenderness?
No.
Okay. No pain or tenderness with light or deep palpation in all 4 quadrants. Her abdomen is soft and non-tender. So we will move on to lower extremity part of the assessment. Of your lower extremities. Alright, looking at the lower extremities, her skin is nice, tan, warm, and dry. her hair is evenly distributed. She has no edema. Her capillary refill on her toes is less than 3 seconds. So we'll check the femoral pulses here. Excuse me. That is nice and equal. Those are +2 bilaterally. We'll check the popliteal pulses. Those are +2 bilaterally. Her tibial pulses are +2 bilaterally, and her pedal pulses are +3 bilaterally. We'll check range of motions of her lower extremities. If you could just pick your lower leg up for me. Any pain or tenderness with that? Okay, go ahead and put that down. Same with the other one. Go ahead and put that down. Any pain or tenderness with that? Okay. If you can try and pick your toes up to the ceiling. Any pain with that? Okay, go ahead and push down. Any pain with that? Okay, perfect. Good range of motion. No pain or discomfort with that. All right. Let's move on to the reflexes. Okay. All right, let's check your biceps. Good. Good. I meant your those were triceps. Now we'll do your biceps. Okay. Okay, good. We'll check your this here. Good. Good. Those were good, and then we'll check your knees here. Good. Good. And then we'll check down here. Good. Good. All right. All of her reflexes are +2 and normal. No difficulties with those. All right, then we will do your sensations. So I do just have a pen cap here. I'm gonna have you close your eyes and you just tell me if it feels sharp or dull, okay?
Okay.
All right. Is that sharp or dull?
Dull.
Okay, perfect. Then tell me if that's sharp or dull.
Sure.
Okay, perfect. And then we'll go to your hand, dull or sharp.
Dull.
Okay. We'll move on to your leg.
Sure.
Okay, perfect. And then we'll move on to your feet. Dull or sharp?
I'm gonna say dull.
Perfect. All right. All of her sensations are intact. Then we will be moving on to the neural part of the assessment. So I will have you just stand up for me. And then I'm just gonna have observe a toe touch here. So I will just have you make sure that I'm out of the way. Yep, okay. So I will just have you, actually, I'm gonna move the bed out of the way, sorry. Maybe. Okay, perfect. So I'll just have you turn this way, and then I'll just have you bend over and touch your toes. Any tenderness at all when I touch your spine?
No.
No? Okay, perfect. Your spine appears intact. You can go ahead and stand up, and then I will just have you do a shallow knee bend for me. Any pain or tenderness with that?
No.
Okay, perfect. And then I will just have you do a heel-toe walk from the bed over to the cabinet. Make sure that we're still recording here. Okay, go ahead. All right, and then I will have you walk on your tiptoes. Okay, and then go ahead and walk back on your heels. Okay, perfect. Any pain or discomfort with that?
No.
Okay, perfect. All right. So after our assessment here, I'm gonna give you 2 health promoting activities. You said that you like to drink a lot of caffeine, so I'm gonna suggest that you take 1 cup of coffee instead of 6 cups per day, and then also drink at least 64 to 120 ounces of water a day. And then follow up with your regular doctor. Do you have any questions for me?
No, thank you.
All right, thank you so much.